practice video for Reading Part B, and you will be allotted 2 minutes to complete each question. The answers will be presented at the conclusion of the video. Kindly record your answers in a notebook for later review.
Beta blockers are medications that slow down your heart and reduce the amount of oxygen your heart needs, which is helpful for many heart conditions. However, they can cause problems for people with asthma or serious breathing issues. This is because beta blockers can tighten the airways by affecting certain receptors in the lungs, making it harder to breathe. The key takeaway is that doctors need to be very cautious when prescribing beta blockers to patients with asthma or severe respiratory conditions. They also monitor patients closely, especially when starting the medication or adjusting the dose to ensure safety. So the correct answer is B. They should be avoided in patients with asthma or severe respiratory issues. The correct answer is B. Regular monitoring is essential for certain anticoagulants like warfarin. Why monitoring is needed? Warfarin is a blood thinner that helps prevent clots. But if the dose is too high, it can cause dangerous bleeding. To avoid this, doctors check a blood test called INR, International Normalized Ratio, to make sure the medication is working safely and effectively. Before surgery, the passage says it's important to talk to your doctor about stopping or adjusting warfarin before surgery. However, it's not safe to stop it on your own. Option A, how anticoagulants work. Option C is wrong because anticoagulants like warfarin don't help with clotting. They actually reduce it to prevent clots from forming or growing. The main idea is that regular monitoring of warfarin is crucial to balance the benefits and risks, especially bleeding. The correct answer is B. Self-monitoring of blood glucose levels is crucial for insulin users. Explanation: importance of self-monitoring. The passage emphasizes that self-monitoring of blood glucose levels is critical for patients using insulin therapy. This practice is essential for understanding how insulin doses affect blood sugar levels but enables patients to make necessary adjustments to prevent conditions like hyperglycemia, high blood sugar, or hypoglycemia, low blood sugar. Proper blood glucose monitoring is a cornerstone of effective diabetes management. Misunderstanding of insulin use. Option A is incorrect because insulin is not typically used as a first-line treatment for all types of diabetes. For instance, it is the primary treatment for type 1 diabetes, but is generally not the first choice for managing type 2 diabetes, where lifestyle changes and oral medications are usually tried first. Option C is also incorrect because insulin therapy does require dietary considerations. The passage clearly states that insulin therapy should be combined with dietary and lifestyle modifications to optimize blood glucose control. Ignoring these aspects can lead to poor diabetes management and potential complications. The correct answer is A. Lifestyle modifications are an essential part of managing hypertension. Emphasis on lifestyle changes, the passage clearly states that while antihypertensive medications are important in managing high blood pressure, lifestyle modifications are also essential. This includes incorporating heart-healthy dietary choices, regular physical activity, and other lifestyle adjustments to effectively control hypertension. Option B is incorrect because it suggests that antihypertensive medications should only be taken when symptoms are present. In reality, hypertension often has no symptoms, the silent killer, and treatment is important even in the absence of symptoms to prevent serious complications. Option C is mistaken because it implies that all antihypertensive medications work solely by dilating blood vessels. In fact, antihypertensive drugs can work through various mechanisms, including lowering heart rate, reducing blood volume, and affecting vascular resistance, so it's not accurate to say that all work only by vasodilation. The correct answer is C. Antibiotics target bacteria and are not effective against viral infections. Targeting bacteria, the passage explicitly states that antibiotics are used to treat infections caused by bacteria. This reinforces the understanding that antibiotics work specifically against bacterial pathogens and do not have any effect on viruses, which are responsible for other types of infections such as colds and flu. Understanding antibiotic resistance. The passage also discusses the importance of appropriate antibiotic use, emphasizing that using antibiotics for viral infections can contribute to antibiotic resistance. This point underlines the need for proper diagnosis and treatment practices. Option A is incorrect because it falsely claims that antibiotics are effective against all types of infections. As noted, they are only effective against bacterial infections, not viral ones. Option B is misleading as it implies that patients should complete the entire course of antibiotics, regardless of their symptoms. While it is generally true that patients should finish their prescribed course to avoid undermining treatment, the statement could be misinterpreted. The guiding principle is that the patient should finish the antibiotics if they are prescribed for a bacterial infection, but this option does not address the distinction between bacterial and viral infections. The correct answer is C. Asthma management plans should include both quick relief and long-term control medications. Comprehensive management. The passage clearly states that effective asthma management involves using both quick relief and long-term control medications. Quick relief medications are essential for addressing acute symptoms and asthma attacks, while long-term control medications are necessary to prevent symptoms and manage chronic inflammation. Key role of both medication types. By integrating both types of medications into an asthma management plan, patients can achieve better overall control of their asthma, leading to a significant improvement in their quality of life. Option A is misleading because while it is true that quick relief medications are used as needed, it does not emphasize the important term control medications necessary for ongoing asthma management. Focusing solely on quick relief medications could lead to inadequate overall control of asthma. Option B is incorrect because it states that long-term control medications are only necessary during asthma attacks. In fact, these medications are meant to be taken regularly, even when a person is not experiencing symptoms, to prevent future attacks and manage chronic lung inflammation. Relying solely on long-term control medications during an attack is not effective and can potentially lead to severe outcomes. The correct answer is B. A balanced diet and regular exercise are essential for maintaining heart health. A healthy diet gives your heart the nutrients it needs, and regular exercise keeps it strong. Together, they are key to good heart health. In short, a combination of diet and exercise is the best way to keep your heart healthy. Thank you for completing this test. These Part B questions are designed to help strengthen your reading skills. Please share the number of correct answers you achieved in the comments, and feel free to share this channel with friends who may also benefit from the practice. Your support is greatly appreciated. Thank you.